Hello, everyone. This is Chris Verselli, owner of Nonfiction Fitness, and I'm here today giving you a special webinar with my good friend and colleague, Dr. Chris Davis. Chris is a medical doctor, trained at Johns Hopkins, and has been a very, very successful practicing physician for the last 14 plus years. And Chris has a really interesting story. He actually started in cardiology, built a very successful practice, and then at one point just a few years ago realized that he wasn't accomplishing his main fundamental goal that he had as a doctor, which was to help make his patients well. And, many of you guys can understand why he might think that, given your experience with traditional medicine, pills and shots just really don't cut it when you're trying to get well. And so Chris changed directions, and now he teaches his patients how to actually get healthy so their body can heal itself of whatever issue it has. And Chris has been a great resource for me. I've talked to him about a number of things. I've learned a number of things from him, and I've worked with him a little bit as well during this shutdown period. And today I've asked him to come on to talk about the system that you see illustrated here on your computer screen, the immune system. The immune system is very complicated. The immune system is very, very important. And we feel like too many people right now are in kind of this cloud of mystery when it comes to their immune system. They hear the term, they know in general what it does, helps fight disease and stuff, but it really does a lot more than that. And we really feel like people need to understand how it works and what they need to do to make it work better in order to take the steps necessary to help make it better. So that's what we're doing here today. So Chris, thanks a lot for coming on. Really appreciate your time. I know you're a busy man, and you have a lot to do even now. But yeah, I'm really looking forward to this discussion today. So let's just jump right in. What do you want to tell us about our immune system, Chris?
Well, thanks, Chris. First and foremost, it's great seeing you again. It's always great having these conversations. Really, thank you for giving me a platform to really help educate our clients about really overall achieving optimal health, and that's what my goal is for each and every one of my clients. So let's talk about the immune system a little bit. Obviously, the immune system is a super hot topic with the whole SARS-CoV-2 or COVID-19 illness. We're all concerned about, okay, do I have a strong immune system? Am I going to get sick with this with the coronavirus? Well, the immune system is super important. Even before the whole COVID-19 thing arose, the immune system is probably one of the most important systems in our body, because not only is the immune system responsible for fighting off infection, the immune system is what controls what inflammation in our body. And one of the things that we now know is that inflammation is probably the root of most, if not all, illnesses, and particularly chronic illnesses, things like diabetes, hypertension, Alzheimer's disease, Parkinson's disease, rheumatoid arthritis, thyroid disease. And I can go on and on and on, and it's all related to inflammation, which is also related to our immune system, or an immune system that is unbalanced.
Wow. So let me just ask you then. So what you're saying is that the immune system actually plays a role in things like heart disease, things like cancer, things like diabetes, those types of diseases, not just viruses and bacterial infections, right?
A pivotal role. Now, as a cardiologist, at the forefront of cardiology and the preventative cardiology is optimizing the immune response. Cardiovascular disease or coronary artery disease or blockage in the arteries is a disease process that's driven by inflammation. And that inflammation is stemmed from our lifestyle choices, the foods that we eat, the cigarettes that we smoke. Those things actually promote more inflammation and an immune system. We're going to talk about some of the cells of our immune system, but they promote those macrophages. We're going to talk about those. You guys will be macrophage experts in a little bit. But those macrophages are what goes into the vessel wall, and they phagocytose, or they eat up the cholesterol molecules. And that's what stems this entire atherosclerotic or plaque buildup in our arteries. So the immune system is absolutely pivotal in many disease processes, particularly heart disease.
Wow. That's such an important thing that you just brought up, because, right now, you know, in today's world, infectious diseases, you know, I mean, there's still an issue. I mean, obviously we got coronavirus, there's the flu, there's a number of them, but for the most part, you know, we have interventions that work pretty well to keep the effects of those diseases at a minimum. But what you're saying is that the immune system also plays a role in what most people are dealing with nowadays, which are chronic degenerative issues, you know, heart, lung, brain. You even were telling me earlier how the immune system's response, the inflammatory response, also contributes to Alzheimer's disease,
Mhm.
which is super fascinating. So, so for me, I'm looking at this and I'm saying, wow, the immune system's strength or lack thereof can in many ways determine whether you're going to get any type of disease, infectious or otherwise.
Mhm.
Correct?
Mhm.
Wow. So this is a
Absolutely.
very important topic then. I really want you guys to pay close attention to what Dr. Davis has to share today, because this is going to help you a lot.
Yeah. I think we'll start. I think today, this will be for you guys out there. This will be part one. I think today we'll talk about the role of the immune system in fighting off infections, whether it's viruses or bacterial or fungal or any other pathogens that we're exposed to. I think that just understand though that there is a very close connection between inflammation, okay, and autoimmunity. Our body's kind of having a hyper response from the immune system, and our body's starting to attack itself. That's called autoimmune disease. It's like rheumatoid arthritis or lupus or Hashimoto's or thyroid problems. So understanding that there is a very kind of fluid relationship between those two things, but we'll start about how our body fights off infection. So just some of the basics of the immune system. What are the organs of the immune system? As you guys look at this image on our screen here, this depiction of some of the important parts of the immune system, you can see probably the most important part of our immune system is our bone marrow, because that's where all of our immune system cells, the white blood cells, originate. They originate in the bone marrow. We'll see shortly when we look a little bit closer at the bones and bone marrow and how these cells and what cells are actually produced. But what happens, these cells are produced in the bone marrow, and then most of the cells, particularly the cells called T lymphocytes, actually go to the thymus after that. And the thymus is this organ that sits right underneath the thyroid. Most of us, by the time we've actually gotten older, the thymus kind of degenerates, but it's very important during our younger years, particularly childhood, to help these T cells develop normally and mature into cells that can fight off infection, fight off these pathogens. The other part of the immune system that's really important is actually the spleen. Most of us have heard of the spleen, but probably don't have any idea what the spleen does. And the spleen is really important for filtering out pathogens, but it's also really important for the production of antibodies. And antibodies, as you guys probably know, are what we need to also fight off infection. And antibodies are actually what are produced when we give vaccines. We give either a weakened virus or dead virus, and our body produces a response to that. And that response are the antibodies. And we have these kind of memory responses, or even called memory B cells. The antibodies are exposed to a pathogen or a foreign invader, and then your body actually develops these antibodies which are then stored up so that a year from now, or 5 years from now, or 20 years from now, when you're re-exposed to that same pathogen, your body can fight that pathogen off very quickly because it has these memory B cells in the form of antibodies. Um, Other parts of the immune system that are really important that most people don't really think about, your gut, your intestines are very important in immune response as well. If you look here, we see these things called Peyer's patches. And Peyer's patches are nothing more than groups of B lymphocytes and T lymphocytes in our intestinal wall as well. So there are a large percentage of our immune system is actually located within our intestinal walls. And then
Wow.
finally, we've all heard of lymph nodes. I'm sure you've all had a sore throat or strep throat, and you had these these swollen glands, again, as my mom calls them, swollen glands. These glands are actually nodes or lymph nodes where also the B and T cells live. And when the infection hits there, this is why there's a kind of a, a swelling of of those nodes when the pathogens are actually exposed to the B and T cells in those nodes. So those are kind of the main primary organs of the immune system. Just to
Wow.
look a little bit further into actually the bone marrow. We talked about bone marrow. I just want to kind of break this down a little bit for you too, so you can understand the different types of cells that originate from the bone marrow. We have these hematopoietic stem cells that come from the bone marrow. And then those kind of develop off into two separate lineages. And we have what's called the myeloid progenitor cells and the lymphoid progenitor cells. Myeloid progenitor cells are all the cells you guys have heard of, your red blood cells, your erythrocytes. We have platelets. Platelets are the sticky cells in our blood that actually help your blood clot when you cut yourself. The platelets stick together and form clots. They're also the same cells that actually help or may be hyperreactive and can contribute to actually forming clots in the heart when you have a heart attack. So platelets being overreactive can also be somewhat problematic. Other cells like eosinophils, basophils, those are really responsive to infections like parasitic infections, worms, or things like exposures from your environment, the pollen in the air or grass. You can have these allergic reactions that typically are eosinophilic responses, or even things like food allergies are related to eosinophils. Neutrophils typically related to bacterial exposures as well. And monocytes, again, viruses typically as well. So those are kind of the myeloid progenitor cells. And then what we have on what call the lymphoid progenitor cells are the B and T cells that we previously mentioned. So B cells can actually end up making the antibodies. And then the T cells also are two separate forms of T cells. One called a T helper cell and another called a cytotoxic T cell. So we'll talk about that a little bit later, I think, in the next slide. I'll give you a little more breakdown into the different parts of our immune system. We have, our immune system is, I like to call it an army. And we have lots of different soldiers that make up that army, and they all respond at different times. And so, our first line of defense from any type of pathogen is actually not a cell, it's some of these anatomic barriers. If you think about our skin, for example, that's actually part of our immune system. Our skin helps to prevent certain organisms or pathogens from actually entering our body. And in fact, in the skin, there are also some of these other immune cells located in the skin that actually help to fight off the infection once they do traverse this epidermis or the outer layer of the skin. Some of the other areas or barriers include the ciliary clearance, or actually in the mucus and the little hairs inside of our airways. The hairs inside of our nose are actually part of our immune response, believe it or not, to help keep those pathogens out. And then really importantly, I think most people don't think about our stomach as being part of the immune system. So why would the stomach be an important part of the immune system? The reality is that acid in our stomach is very toxic, obviously, to many pathogens, viruses, bacteria, fungus. So it's really important to have adequate acidity within the stomach. And so one of the things that I want people to realize is that knowing that the acidity of your the gastric pH is really important. One of the things that a lot of us do and tend to do too often is that people tend to take a lot of these antacids, or what we call proton pump inhibitors, Prilosec or Meprazole, way too frequently. And so as we start to block acid production, obviously we've talked about the importance of that as part of an immune response. We are setting ourselves up for being more apt or a higher likelihood of developing some of the infections, because we now can't have that first anatomic or physiologic barrier because of the acid in the stomach not being where it should be. In fact, most people think the reflux is actually a condition of too much acid, when in reality, most reflux or GERD symptoms or heartburn are actually related to too little acid in the stomach. And I know that sounds like that, well,
Wow.
that doesn't make sense, but the reality is when studies have been done, and we know that what ends up happening is you have a food particle. Say we had a big old piece of steak and we don't have enough acid in our stomach. Well, it doesn't get digested. So it just kind of sits in our stomach here. And then that causes more of those reflux symptoms as opposed to not having enough acid in the stomach. So I really caution all of you all to be very careful with the amount of the acid medicines that we take. There are lots of other reasons to be cautious of long-term antacids, but this is just another one of those things to be with regard to the immune response. And then lastly, the lysozyme and tears and saliva are also really important for the immune response.
Wow. Fascinating. Yeah, those are all organs that you don't really think about as being part of your immune system, you know, the skin, the stomach, but makes total sense. And so you're saying that people that take antacids can actually be lowering their immunity to diseases of all types. Is that correct?
Absolutely, absolutely. That
Wow.
stomach pH is very important. So there are lots of other ways to to heal the stomach and to help with those gastroesophageal reflux or heartburn symptoms. Really, it's lifestyle changes. It's avoiding the things that typically cause that, and so that's another lecture in itself. But you know, the proton pump inhibitor is not necessarily the best answer to that, and in fact has a lot of problems long term, including things like cognitive decline, kidney issues, osteoporosis. Those are all things that are potential consequences of um, protracted use of the proton pump inhibitors. Um,
Wow.
so yeah. So
Stuff
other
your doctor won't
go
usually
ahead.
tell you, hey, doc?
No, but to be honest with you, you know, one of the things that'd be really interesting, I want all of you guys, if you're on a proton pump inhibitor, to look at the package insert. And on all of those, prilosec, omeprazole, pantoprazole, they all say you should not take this product for more than 2 weeks in a row. Yet I have people who come in and they've been on this medication for 10 years. And
Yeah,
it's quite
I've
frequent
seen that
that
a
that happens.
lot as well.
Quite frequent that that happens. Um, so yeah, so be aware of that. The other parts of the immune system, really importantly, are the innate immune system and the adaptive immune system. And the way I like to think about this is the innate immune system are the non-specific immune response that happens fairly quickly within hours of a pathogen or a foreign invader coming in. You have these white blood cells, all of which are the macrophages, the neutrophils, the natural killer cells. And what they do, for example, if we take the neutrophils, if you look at this little neutrophil here, you see all these little dots in there, these little granules. These little granules actually are very toxic to any pathogen that they're exposed to. So what happens is the pathogens get in, the neutrophils are called immediately to these pathogens, and then they unleash these lysozymes on the pathogens to destroy them.
Wow.
The other cells that really are effective is actually the macrophages. Macrophages also home into these pathogens and they engulf. Literally, I like to think about macrophages as little Pac-Men. And in fact, there's a lot of animations that show macrophages as Pac-Men, and they kind of come in and they engulf whatever the pathogens are. And then in turn, though, the macrophages kind of serve have another role as well. When they engulf that pathogen, then parts of that pathogen then are in turn expressed on the outer lining of these macrophages. So they engulf it and then they express a portion of that pathogen or foreign invader on the outside, and then they present that pathogen to this adaptive immunity or adaptive immune cells, like the T cells and the B cells. The dendritic cells are very similar. They are actually antigen presenting cells as well. And so they actually take pieces of the pathogens they're exposed to, they present them to these T cells and B cells, which are these typically may take days to weeks to form, but these are more specific. They specifically act with a specific action to whatever that pathogen is. And so they're kind of drawn to the pathogen from the macrophage or from the dendritic cells. B and T cells are what we typically think about, most of us, when we think about immune responses. The B cells, again, we talked about earlier, making these antibodies. B cells are responsible for producing the antibodies which respond to the pathogens and have kind of a memory component as well when we're re-exposed to a similar pathogen, whether it's months or years later. T cells are also really important because they have what's called there's a T cell called a cytotoxic T cell. Cytotoxic T cells are really attracted to the pathogen and essentially attack the pathogen and destroy it again with different chemokines that they actually expose the pathogen to. So again, you can see the complexity of an early response, a late response, and how all these things kind of work together. And it's really important that there is uh, a sequence of events that that is optimized so that all of this stuff happens appropriately. You can imagine that if the timing and the sequences are not right, then you can have a response that's not adequate, or you can have a response that is a hyper responsive. Again, we're like when we talk about with autoimmune conditions.
Wow. Wow, so fascinating. You know, it makes me think back to when I was going through chemotherapy treatment as a teenager, and they told me that I basically had lost, because of the treatment, my innate immunity to almost everything. And so if I was exposed to anything, it would come in and just have its way with me. And so as I'm listening to you, I'm imagining how now things are so different. You know, how now if I have, you know, some virus or bacteria come into my body, how the neutrophils come and just stomp it out, and then the macrophages come and just cast it out. But then they also bring a little portion of it to the T cells and B cells and say, hey, come up with a vaccine. You know, I mean, that's just fascinating to me that God has made our body in such a way that we literally are like a vaccine manufacturing plant. You know, it's like everybody's talking on TV about how they want to find a vaccine for COVID-19. Well, our body produces vaccines all the time based on what you're saying, correct?
Yeah, well, that's essentially what a vaccine is. Yeah, I mean, essentially what vaccines are you're giving a weakened portion for a particular virus, a weakened virus or a dead virus, and we let our body do its thing. We produce antibodies to it. So that is what a vaccine actually is. You're actually
Wow.
getting your body to produce these antibodies so that the next time you're exposed to the true live virus, for example, when we get a flu vaccine, we're getting an inactivated virus. So our body still notes that pathogenic form, or it's called an antigen. Okay, our body still notes that antigen, binds to it, develops an antibody to it, and then again next year or 6 months down the road, we have antibodies that when I'm exposed to a live virus, the antibody can come in and kind of get at it and destroy it.
Wow. That's amazing. So when everything's working the way it's supposed to work, things tend to go pretty well inside the body, right?
Yeah. Yeah.
Well, what do these cells need to function well?
So I think one of the things you just said is when everything is working correctly, and so we're gonna there are lots of components to a optimized or appropriately functioning immune system. But I think today what we really want to talk about are some of the vitamins and minerals that are really important for appropriate immune response. I think we've all heard a lot in the media, particularly with given this COVID-19, about the importance of things like vitamin C and vitamin D, but there are a few more vitamins and minerals that are really important in immune responses, and you can see them here on the screen here, but there's vitamin A, there's vitamin D, there's vitamin C, vitamin E, the B vitamins, folate, which is vitamin B9, iron, zinc, copper, selenium. So it's really important that we have adequate levels of all of these vitamins to have an adequate immune response.
Now, is that because the vitamins themselves are necessary for the formation of these immune system cells, or is there more to it?
They're very important, just cofactors. A lot of these vitamins are cofactors in the reactions that have to occur for these processes to happen.
So the processes of the immune system cells actually fighting the virus?
Correct.
Wow.
Correct.
So you can have the immune system cells, but not have the vitamins, and you still won't. It's like not giving the soldier ammo for his gun. Is
That's
that
right.
kind of
Those
a good
cells
way to look at it?
Yeah, those cells don't respond normally. So activation of T cells, activation, for example, we know that T regulator cells are very responsive and important to have normal vitamin D levels. So they just don't respond normally when they don't have the appropriate cofactors.
Mm-hmm. Wow. So if you're even deficient in vitamins and minerals for a couple of weeks, you know, it matters, right? Because for those couple weeks, you don't have what you need to fight off disease, right?
Well, theoretically, but a vitamin store typically, I mean, each one is different. So, you know, we tend to have stores of a vitamin. So, I mean, if you're how much your immune system is down, say if I know I'm vitamin C deficient for for a period of 2 3 weeks, and then certainly yes, during that time, then we probably are not going to have an optimized immune response during that time. So, yeah, the answer to that question is yes.
So then during a time like now when, we're all concerned about getting sick, it would be a really good time to optimize your vitamin and mineral levels so that your immune system can work as well as possible,
Absolutely,
right?
absolutely, absolutely.
So then, so here's my next question. So, there's probably a lot of people out there that would say, well, I take all these vitamins every day. Is that enough in your opinion, Dr. Davis? Is it enough to take like a typical vitamin supplement you'd get at Walgreens or GNC or one of those kind of places?
Well, let me say, so you have to be very careful with the supplementation. You because you never know what you're getting, and how do you know what you're getting? I can't tell you 100% how we know that. Certainly the quality of the product. I'm not sure. There's a couple of websites we can use to kind of figure out the quality of the product. There's nothing like actually measuring levels to kind of figure out whether my vitamin levels are okay or not. There's certainly
Right.
different ways to do that. We have urine testing. Most recently, we've really introduced a very cool new technology that looks at hair follicles. That's able to measure all of the micronutrients and a host of um, other variables that are important for overall wellness. But we've been using the hair follicles to look at micronutrients recently.
Wow. So you can actually take a strand of your hair, send it to a lab and have them analyze it and tell you whether you're deficient in vitamin A, D, C, E, B6, folate, iron, zinc, all that stuff. Is that what you're saying?
Absolutely, absolutely.
Wow.
This technology is pretty amazing. It works on quantum physics, where we actually are looking at different frequencies. Each one of these minerals and vitamins, actually, believe it or not, have a specific frequency. And so we're able to do analysis using technology out of Germany to measure your micronutrients. More importantly, we're doing things like looking at your exposure to micronutrient. Exposure to EMF from your cell phone, from cell phone towers, from microwaves, from televisions. And so we're going to hear more in the future about some of the issues with EMF, electromagnetic frequencies, and its role in chronic health issues.
Wow. Yeah, I definitely want to do a whole interview on that as well, because that's a very, very important topic. So, are most people being told by their doctor to get these types of tests or no?
No, I'll be honest with you. Most people don't do the micronutrient testing. There's a lot of integrative medicine doctors or functional medicine doctors who may order micronutrient testing, but I don't see that test ordered very frequently. And believe it or not, understanding the vitamins and minerals are very important. When we think about, the major energy regulators in our body, or the major biochemical processes that occur, there's a process called the Krebs cycle, and it is very dependent on a lot of these cofactors. So a lot of the B vitamins, for example, and so understanding and to optimize your overall to optimize health, we have to make sure that all these micronutrients are optimized. And so for cells to function optimally, they have to have what they need to work. I mean, that's not rocket science. And so utilizing the micronutrient panel has been just a game changer for us.
Wow. That's amazing. And I already knew that you were doing this through blood, but the fact that you can do it now through hair, I mean, that's just amazing. That's a real game changer, because I know a lot of people, right now they don't even want to leave their house, some of them, and they might not want to go to a doctor's office. They might not want to have a needle stuck in their arm and blood drawn. So now what you're saying is those people can have a hair strand pulled out, and they can just do it all that way. And they can, and you did say they could mail it in, right?
Absolutely. So I just actually switched my screen. I don't know if can you see this screen there?
Uh-huh.
This is actually a sample report from one of the hair screenings, and so Right now, we can do one of two ways. We have devices in our office, but we also have a device, particularly when we're still on the quarantine, where we send the kit. You actually pluck out 3 or 4 strands of hair, and we send it to the company. We process it within 24 hours. We have a result to look at all these things, like all of the vitamins we talked about, the B vitamins, vitamin C, vitamin D, vitamin B. And again, this is just a piece of kind of some of the stuff that we're able to see. Here's another energy production indicator. So people who have chronic fatigue issues, or just don't have any energy, let's look at your amino acids. Again, all of the vitamins. So these are the things that we can garner just from a hair strand. So this technology
Wow.
is going to be a game changer.
So I think what you just said bears repeating. You can actually tell how much of the energy producing nutrients people have inside their body through this same hair test, correct?
Yes,
So
absolutely.
people out there that are feeling tired and feeling, like they just don't have that get up and go, they can have this test done and maybe even see why that's the case,
Oh, absolutely.
right?
A
And then
lot,
they'll know what to do about it.
this is just a piece of the information from this test as well. And I think we should dedicate a whole show to this test,
Wow.
because this is
Yeah.
kind of, this test really is a game changer as far as assessing what's going on with you, and as far as looking inside to optimize your overall health. And so, yeah, I mean, there's a lot of facets to it, but unfortunately, I think today we have a lot of time to talk about the entire test.
Wow. Well, I definitely want to pick back up on that next time. And like the famous quote says, you can't manage what you don't measure, right? If you don't know where you're starting from, then you don't know what to do to
Right,
improve
right,
your
right, right.
situation. So definitely get this test done if you want to have a stronger immune system and you want to be healthier overall. Um, and so I know we have a few more minutes, Doc. I know there was something else that you wanted to cover here as well about nitric oxide, correct?
Yeah, Chris, I'm gonna have to cut. I'm gonna have to cut. Sorry. Yeah.
Okay.
Yeah, I'm late for this other call already.
All
I
right.
have 5:30. They're on a conference call.
Yeah,
So
absolutely. Well, I greatly appreciate your time and your expertise today, Dr. Davis. We will be back with the next installment very soon. So keep checking your inboxes, and you'll be very excited to see it. So have a great day, man. Thank you so much, and thank
thanks.
you all who are viewing.
All right, thanks. Bye bye.